Leukemia is a type of blood cancer. It is a complex disease that affects the blood and bone marrow, the spongy tissue inside bones where blood cells are made. It primarily impacts your white blood cells, which are crucial components of your immune system. These cells are your body's defense against infections, playing a vital role in keeping you healthy. In leukemia, the bone marrow, which acts like a factory for blood cells, starts producing abnormal white blood cells. These cells are not fully developed and are often referred to as blasts or leukemia cells. These abnormal cells don't function properly. They can crowd out the healthy cells, leading to a shortage of normal white blood cells, red blood cells, and platelets. This imbalance can cause a range of health issues, including anemia, increased risk of infections, and problems with blood clotting. There are several different types of leukemia, each with its own characteristics and treatment protocols. The main types include acute lymphoblastic leukemia, AL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. Treatment varies significantly depending on the type and stage of the disease. Some types of leukemia are aggressive and progress rapidly, requiring immediate and intensive treatment. Others are slow-growing and may not need treatment right away. Understanding the nature of your specific type of leukemia is crucial for determining the best course of action. Receiving a leukemia diagnosis can be a life-changing event. It's important to work closely with your healthcare team to understand your diagnosis and develop a personalized treatment plan. This plan may include chemotherapy, radiation therapy, targeted therapy, or a combination of these treatments. While a leukemia diagnosis can be overwhelming, it's important to remember that significant advancements have been made in the treatment of this disease. Research is ongoing, and new therapies are continually being developed, offering hope for better outcomes. Many people diagnosed with leukemia go on to live full and active lives. Survivors often share their stories to provide hope and encouragement to others facing the same journey. With the right treatment and support, it's possible to manage the disease and maintain a good quality of life. This guide is designed to provide you with the information and support you need to navigate this journey with courage and hope. It includes resources on treatment options, managing side effects, and connecting with support groups. Remember, you are not alone in this fight, and there is a community of people ready to support you every step of the way. Leukemia often presents with subtle symptoms like fatigue, unexplained bruising, or frequent infections. These symptoms can easily be mistaken for less serious conditions, making early detection challenging. Fatigue might feel like just being overly tired from a busy week, and bruises could be attributed to minor bumps or injuries. Frequent infections might seem like just a run of bad luck with colds or the flu. If you experience persistent and unusual health issues, it's crucial to consult your doctor. Don't ignore these signs, especially if they persist over time. Early consultation can make a significant difference in diagnosis and treatment outcomes. Your doctor will listen to your concerns and take a detailed medical history to understand the full picture of your health. They will likely order blood tests to check your blood cell counts. These tests are essential in identifying any abnormalities in your blood, such as low red or white blood cell counts or platelets. Blood tests can reveal a lot about your overall health and are a critical first step in diagnosing leukemia. If the blood tests indicate abnormalities, your doctor might refer you to a hematologist, a specialist in blood disorders. Hematologists have the expertise to delve deeper into the specifics of your condition. They will conduct further tests and provide a more detailed analysis of your blood health. The hematologist may recommend a bone marrow biopsy for a definitive diagnosis. This procedure involves taking a small sample of bone marrow, usually from the hip bone, to examine under a microscope. It helps determine the type and stage of leukemia, which is crucial for planning the appropriate treatment. This procedure, while sounding intimidating, is routinely performed and helps determine the type and stage of leukemia. The biopsy is usually done under local anesthesia, and while you might feel some pressure, it is generally not painful. The results from this biopsy provide critical information that guides the treatment plan. Receiving a leukemia diagnosis can be a life-altering experience. It's natural to feel a whirlwind of emotions, from shock and disbelief to fear and sadness. The diagnosis marks the beginning of a journey that will require strength, resilience, and support. It's normal to feel overwhelmed, scared, and uncertain. These feelings are valid and part of the process of coming to terms with the diagnosis. It's important to acknowledge your emotions and give yourself permission to feel them. Allow yourself time to process the news and don't hesitate to lean on your support system. Family and friends can provide emotional support, practical help, and a sense of normalcy during this challenging time. Open communication with your loved ones can help them understand what you're going through and how they can best support you. Remember, you are not alone in this journey. There are support groups and resources available to help you navigate this difficult time. Connecting with others who are going through similar experiences can provide comfort, understanding, and valuable insights. Support groups can be a source of strength and encouragement, reminding you that you are part of a community that cares. Once diagnosed, you'll need a team of experienced healthcare professionals to guide you through treatment and recovery. Your primary doctor will play a crucial role, but you'll also need to connect with a hematologist-oncologist, a specialist in both blood disorders and cancer treatment. Seeking a second opinion from another hematologist-oncologist is always advisable. Getting different perspectives can help you make informed decisions about your treatment plan. Your care team will likely include nurses, social workers, and other healthcare professionals who will provide comprehensive support throughout your journey. Building trust and open communication with your healthcare team is crucial. Don't hesitate to ask questions, express concerns, and actively participate in decisions regarding your treatment. Remember, you are your own best advocate. Section 4. Insurance 101. In this section, we will delve into the essentials of understanding your insurance coverage and managing the associated costs effectively. Understanding your coverage and managing costs is crucial, especially when dealing with serious illnesses like leukemia. Knowing what your insurance covers can significantly reduce the financial burden. Leukemia treatment can be expensive, but understanding your insurance coverage can help alleviate some financial stress. It's important to be aware of the various aspects of your policy, including what is covered and what isn't. Review your policy carefully, noting coverage for doctor visits, hospital stays, medications, and specific treatments like chemotherapy or bone marrow transplants. Pay attention to the fine print and any exclusions that may apply. Specific treatments such as chemotherapy or bone marrow transplants can be particularly costly. Ensure that you understand the extent of your coverage for these treatments to avoid unexpected expenses. Don't hesitate to contact your insurance provider directly to clarify any confusing terms or limitations in your policy. They can provide detailed explanations and help you understand your benefits better. Many hospitals have financial counselors who can help you navigate insurance claims, explore payment options, and identify potential financial assistance programs. These professionals are there to support you through the financial aspects of your treatment. Financial assistance programs can be a lifeline for patients facing high medical costs. These programs can offer grants, reduced fees, or other forms of support to help manage expenses. Facing a serious illness like leukemia involves not only medical challenges, but also financial considerations. It's normal to feel overwhelmed, but there are resources available to help you manage these concerns. By being proactive and informed about your insurance coverage and available resources, you can take control of your financial situation. Researching and understanding your options can make a significant difference. You can focus on your health and well-being with greater peace of mind when you know that your financial matters are in order. Taking the time to understand your insurance and seek out assistance can lead to a more positive healthcare experience overall. Additionally, consider joining support groups where you can share experiences and gain insights from others who have navigated similar challenges. These groups can provide emotional support and practical advice. Organizing your medical bills and insurance documents can also help you keep track of your expenses and manage your budget more effectively. Create a system that works for you, whether it's digital or paper-based. Long-term financial planning is another important aspect to consider. Meeting with a financial planner can help you create a strategy that addresses both your immediate and future financial needs. Remember, communication is key. Regularly check in with your insurance provider and healthcare team to stay updated on any changes to your coverage or treatment costs. Keeping an open line of communication can prevent surprises and ensure you are always informed. Ultimately, understanding your coverage and managing costs effectively can lead to a more manageable and less stressful healthcare journey. By taking these steps, you can focus on what truly matters, your health and recovery. Section 5. Preparing for hospital stays. Practical tips for a smoother experience. Hospital stays are often necessary during leukemia treatment, especially during intensive phases like chemotherapy. Packing thoughtfully can make your stay more comfortable. Bring essentials like comfortable clothing, toiletries, books, magazines, or electronic devices for entertainment. Consider bringing items from home that bring you comfort and a sense of normalcy, such as family photos, favorite blankets, or small plants. Remember to pack important documents like your insurance card, identification, and a list of current medications. Hospital environments can feel sterile and impersonal. By personalizing your space with familiar items, you can create a more welcoming and comforting atmosphere during your stay.